Hi, I am Dr. Mariam Manoukian.
And I'm Dr. Jerry Manoukian.
And we're going to be talking about the impact of lifestyle on health and disease. Within the last 30 years, what happened in Western countries is that the major diseases that are shortening longevity are non-communicable diseases, which are obesity, diabetes, heart disease, cardiovascular disease like strokes, and cancer. What is happening, what has happened within the last 30 years? The production of food has dramatically changed. Everything is done to sell the food. And as a result, many additives that do not belong in our food now penetrated into the food, and we are eating it on a daily basis. And those are large amounts of sugar, salt, food additives, as well as food coloring and many other compounds that do not belong in our diet.
You've used the term industrialization of the food. What are some examples of that?
Well, packaged food, processed food, putting additives that will keep the food for years, enlarging portions, like going to a movie theater and having a humongous container of popcorn or soda. The fast food chains, making food available everywhere at any time. And that's not just that, it's also the increase in the sedentary lifestyle. People sit at a computer. In the Bay Area, we have people sitting at the computers for 12 hours. Everyone is driving a car, and COVID time, people sat even longer. Basically, they walked less. The other part of the change of lifestyle, the impact of lifestyle on health and disease, is the stress. So the three things we're going to talk is diet, sedentary lifestyle, and stress level. Now, the stress level hasn't changed. It's different for our generation, for our children's generation, and for our parents and grandparents, but certainly they had their share of stress. But in regards to the diet and sedentary lifestyle, there is a big change, and that's what we're going to talk about.
The three heads of the dragon.
The three heads of the dragon, remember, and we are going to try to chop those heads of the dragon.
So when you talk about an industrialized diet, what would be some of the major factors that you would like to discuss?
I would like for people to pay attention to what is food that is actually grown in the farm and what is food that is prepared in factories by people, which is, again, putting the food in plastics, adding this additives, adding sugar,
So some shortcuts that the patients could look at would be, how is the food presented? Is it coming in a package? Is it coming in a paper bag? How many ingredients are listed? How many of the ingredients can you actually read and pronounce?
Right, certainly. And Michael Pollan says that when you're buying food that is sold in a packaged form, make sure that it doesn't have more than 5 ingredients. And certainly good idea to make sure that you can pronounce those.
One of the things that would be on the label, should you buy food that has a label, would be the carbohydrates, fats, proteins. We'll be discussing that in more detail later.
But certainly we want to talk about sugar maybe right now, because sugar is a major culprit. It is a drug. People get addicted to sugar, and when you eat sugar, you want to eat more sugar. So we hear all the time, I have a sweet tooth. And this sweet tooth doesn't happen in one day. It's generated with the help of our mothers, our grandmothers, food industry. Everyone wants to give you sugar. Years of eating sugar, particularly in liquid form, like in form of sodas and juices, we produce insulin. Insulin is trying to put sugar into the muscle. It's trying to put the sugar into the liver. But with time, it is unable to, there is no more room in the sugar, and we're not moving, so the muscles are not using sugar, and as a result, the sugar is deposited as fat in our body, around the belly, in the liver.
Is there a difference between natural and processed sugar?
Natural sugar certainly is in a fruit form, and there is a big difference because even though the sugar content in an apple is not that little, but at the same time apple is full of fiber. So when the sugar is consumed in a form of fiber, the insulin production there's no spike, and as the absorption of the sugar is much slower. Plus, when you're eating an apple, you consume multiple important micronutrients.
As opposed to something like apple juice, which doesn't have as much fiber, if any.
Yeah, exactly. Why would you take the fiber out of your food and just drink sugary drink? And plus, if you drink a glass of apple juice, it probably has the sugar from 3 apples and no fiber.
One of the common adulterants or ingredients in so-called food is high fructose corn syrup. Would you like to talk about that a little bit?
Yeah, high fructose corn syrup was one of the inventions of food industry because it was cheaper than sugar and sweeter than sugar. What they did is, if in an apple or in sugar there is 50% glucose, 50% fructose, then they made a compound that had 55% fructose, was sweeter, and it was put into sodas, into food, and as a result, it was actually not beneficial, but it was a lot worse for people to consume high fructose corn syrup because that was one of the causes of fatty liver. Now, Dr. Robert Lustig has talked a lot about this. He's a pediatric endocrinologist from UCSF, and if you want to learn more about this, please read his writings. But in general, since there was a big deal about high fructose corn syrup, you would notice that in the supermarket foods there is less and less of high fructose corn syrup. Suddenly, sugar there is more sugar in the packaged foods than high fructose corn syrup.
And I think there's an important teaching point or potential teaching point with high fructose corn syrup because it reflects changes in food technology, the ability to do things because we can. It reflects a response to imported sugar from outside the country, and it was basically a cheaper way to satisfy sweet tooth.
Certainly margarine comes to mind, and the trans fats, which are a very similar food industry manipulation of food, which helps you to preserve the food, but at the same time, it has increased the heart disease, atherosclerosis, much more than butter. So now we have certainly regulations about the amount of trans fats in food.
So what about artificial sweeteners?
Artificial sweeteners are, I'm sorry to tell you, pretty bad, particularly the sucralose, saccharin. These are, and NutraSweet. They were originally a great idea because suddenly the food is sweet and it doesn't have sugar, it doesn't require insulin. But turns out that it actually manipulates your brain, and since there are no calories, you keep looking for calories. So it's been shown that people who are drinking diet drinks versus regular drinks, there is no difference in the diabetes or obesity rate. The other important thing is that microbiome, our gut bacteria, our big friend that we're going to talk about shortly, is majorly disrupted by artificial sweeteners. So stay away from artificial sweeteners.
What about natural artificial sweeteners like stevia? Yeah,
stevia, it turns out, is probably better. We still need to see more studies, but I think that stevia doesn't disrupt the microbiome, but at the same time, the concept of our brain still looking for food is still there, because that's how we're trained. We eat sugar, there is calories come with it.
How would you advise patients when they want to stop eating sugar? Clearly, the new trends in fast food are putting just the right amount of salt, just the right amount of sugar to ensure repeat customers, even to the point of causing sugar addiction. What do you tell a patient when they want to get out, break that cycle?
Yeah, I mean, you said it. It's a sugar addiction. It is a real drug. It's actually sometimes compared to heroin because it stimulates the same centers in the brain. What happened, one more fact, at the beginning of the 20th century, an average American ate 4 pounds of sugar per year. Today, an average American eats 120 pounds of sugar. So this is certainly a major addiction. And it comes, anytime there is addiction, it comes withdrawal and it comes dependence. And that's what happens with sugar. And just like we need a rehab for people who are on heroin, or the same thing needs to be done with people who consume large amount of sugar, so-called sweet tooth people. The taste bud rehab, that's what we need. Now, remember that insulin is produced in response to sugar consumption. So when insulin comes out, sugar goes down. But then there is insulin, so we look for more sugar. So one of the ways to stop this is to actually try to bring that insulin down by slowly stopping to consume sugar.
And we will be talking quite a bit about insulin resistance and this metabolic syndrome, which is an outward pattern where we recognize insulin resistance. I think that's going to be a recurrent theme.
Okay.